dental tourism will always be there. And there are good clinicians all over the world, and I think it is essential that if you do want treatment abroad, you've got to investigate and find the right clinician who's going to do the best work they can for you. But you've got to be aware that if you're going to have treatment done elsewhere and you come back and have problems within the UK, you may not have anybody who will help you because things may be complicated regarding what was the implant system that was used, and there are over 600 different implant systems around the world, and it becomes more and more complicated, and as a consequence the costs will increase. So if it's simple implant treatment and you have it on board and you are confident in your clinician and there's no complications, then I don't think it's an issue. But if there are problems and you are in the UK, you will have to consider what you will need to do. We have patients who come in and ask, why are dental implants expensive? And why are some implants cheaper than others? And I think, as a patient, you have to make a decision based on, why are you having this done? Do you want to have something done cheaply? Because you can't have something done cheaply and it still be good. Now, as a periodontal specialist, as a gum specialist, I lecture on dental implants, and I also work with quite a few implant companies. I'm a key opinion leader, and some of these implant companies that I'm working with are at the cutting edge of implant dentistry. And I would, as a clinician, rather be putting the best implant in my own patients, so that if there's any issues in the future, they can be resolved as we have a good backup from a well-known company. As a periodontal specialist and an implant dentist, I myself, when I see my own patients, I use my cone beam CT to assess how good the quality of the bone is and if there's sufficient bone for the placement of an implant, so that I can avoid any of the dangerous structures that could cause problems for a patient in the future. I can also precisely plan how to reconstruct the bone to accommodate your dental implants so that we will have long-term success for you. So here within the practice we utilise the latest technology by using our CT scanner to assess the bone that you have, and from that we can then generate a virtual image to plan your implant placement within the computer model. And as a consequence, we can then avoid any mistakes or any deviation from the plan. We also have a 3D intraoral scanner which will avoid impression techniques, so that we can then construct, again, your custom-made crown from a 3D printed model. Things are just moving on very quickly within implant dentistry, and it is important that your clinician and me as your clinician will be at that cutting edge.